Hello, everybody. My name is Michael Freeston, Director of Quality Improvement at the Early Years Alliance, and I'm delighted that you're choosing to spend your Tuesday evening with us, an hour of it at least, in the company of Dr. Jo Verrill from CEEDA. Please say hello, Jo.
Good evening, everyone. Delighted to be here tonight.
And we're looking to share with you the findings of some research that the Early Years Alliance and CEEDA have undertaken, commissioned by the Greater London Authority, looking at the support needs of London's early years providers in light of the COVID-19 pandemic. The way we're going to structure today is we will spend 15-20 minutes talking you through the headline findings that have come in from the range of surveys, focus groups and roundtables that we've offered, but also share with you some of the emerging areas of recommendations that we will be putting forward to the sector, and inviting your comments and consideration as to whether you feel as though it reflects your understanding of the circumstances you face as we are hopefully moving into the phase where, vaccines permitting, we start to see light at the end of the tunnel for the pandemic. Please don't spend too long trying to write everything down. There's a lot of information coming your way this evening. It really is just inviting your thoughts, give considerations to the findings, make sure they reflect your understanding of the situations we face, and to share any comments or questions you have. Just to move us on, we don't show webcams on these live streams just because it makes for a huge file when it comes to the recording, which makes it difficult for people to download and stream. But just so that you have an idea of what we look like, Jo is on the left there and me on the right. Apologies, Jo, that was a blow up from a rather small photograph I had, so I lost you in resolution a bit. But
it's probably best to be hazy.
Okay. So the aims of the session today is to present the findings, as I said, of the research that we've been undertaking about the last 5 or 6 weeks, share the conclusions of the research and outline how these will shape the recommendations, and then also invite your considerations and comments around the work in general or anything else you wish to share with us. Just by way of background, the objectives of the research were to basically do supply and demand analysis of the support needs, business support needs of London's early years sector. At the time, the commissioning took place back in the summer, and we were expecting this autumn period to be when we were into the recovery period, and clearly it hasn't quite panned out that way, but hopefully now into the spring particularly, we should start looking towards the 2021-22 financial year as the recovery period. To get a better understanding of the business support need that is currently available for London's providers, and to deliver a series of recommendations about how that framework can be improved. All of this is underpinned by the Mayor's acknowledgement that the early years sector will play a vital role in London's economic and social recovery. And I think it's important to stress the issue that it's the social element as well as the economic circumstances about which the Mayor is animated, but also recognises that actually across London, the Mayor has no statutory role in the provision of early years education and care, that residing with the London boroughs. Okay. Jo, over to you to run us through, and please tell me when you want me to change slides.
Super, thanks, Michael. So just to give you an overview, really, as Michael said, of some of the key findings coming through, and we're going to focus this evening on the demand side of the equation, so what providers have been telling us that they need in terms of business support. So the project kicked off in October, and we've been very busy since then collecting data from a whole range of sources, including a survey of providers in London, which included 237 nurseries and preschools, 12 maintained nursery schools and 269 childminders. And when I come on to refer to the findings during the slides, you'll see we use the term non-domestic providers in the charts, and that is just a shorthand for feedback from nurseries, preschools and maintained nursery schools, just to flag that from the start. We also surveyed the views of London stakeholders and business support providers. This was a wide range of people, from local authority colleagues through to private and voluntary sector business support providers, a whole range and mix of organisations in there. We've also done one-to-one stakeholder and provider interviews to get behind the number crunching in more depth and to explore people's views and opinions on solutions going forward, as well as focus groups with providers and stakeholders as well. If you could move us on, Michael.
Thank you. Oh, clearly not. There we go.
So the first couple of slides are just really looking at how providers are doing right now in London in terms of overall position. So on the left-hand side, we have feedback from non-domestic settings, where 60% are reporting struggling, basically at present, and focused on survival over the next 12 months. And 4% are in a worse still situation in terms of looking at an immediate risk of closure. On a little bit more of a positive note, there is around a quarter of nurseries and preschools that are feeling stable and solid for the long term, but don't have any growth plans. And remarkably, around 1 in 10 providers are actually growing at the present time, gradually through organic growth, and a very small proportion, just 1%, are actually growing quite rapidly and have significant plans for expansion. So the picture clearly is one of great concern, but there are segments of the sector in London that are doing okay and holding their own. On the childminder side of things, again, a big chunk in the orange there, 50% of settings that are thinking, you know, it's a fight or flight over the next 12 months. 6% are actually looking at winding down in the very near future, and around 41% are feeling stable, solid enough, you know, to continue going forward. 3%, so a smaller proportion, are looking at growth in the next 12 months. Thanks, Michael. We asked about the challenges that people are facing at the moment, and this was sort of in every aspect of the business, and it won't surprise you to see that despite all the current issues with COVID, the inadequate funding rates that are below delivery costs still stands out really as one of the top challenges for the sector. Obviously, this has been a very long-standing and historic problem, which the pandemic has now overlaid with declining demand. So as numbers fall, so the cost of providing a place per child rises, so that the whole situation has got rapidly worse very quickly. Overlaid with that, we've seen increasing staffing costs, both in terms of hourly rates, but also in terms of the additional costs of deploying staff in bubbles in order to manage the impact of positive test results on the wider setting. So there's a whole mix of things in there which combine both long-standing problems and all of the different challenges that the pandemic has brought about. Just to explain some of the abbreviations in the charts there, on the financial difficulty element, 1 in 4 are saying that they are experiencing a short-term financial difficulty, whilst towards the lower end of the chart on the left, long-term financial difficulty is just abbreviated to LT, to get that on the chart there. So a whole range of things. And of course, there are also issues not charted on here that were cited by fewer respondents, but the full report would go into that in some depth. On the childminder side, again, financial difficulties are topping the chart at 63%, along with declining demand. So it's a similar picture really across the board, and lots of concerns raised there. Interestingly, late payment from parents is a factor in the mix. 24% said that in terms of nurseries and preschools, and also 15% for childminders. And there's a real potential for that to become more of a problem as the furlough scheme falls away and households are experiencing more financial stresses and burdens. Thank you, Michael. So we asked quite a lot of detailed questions about the types of business support that people would be interested in accessing, and this chart just summarises what the overall demand levels were. If you basically grouped all the different categories together and just asked, you know, if you were interested in accessing any form of business support. So at the very broadest level, and this particular slide is looking at nurseries and preschools, overall 2/3 of providers would be interested in accessing some form of business support. There are some variances across the piece, but actually, given the sample sizes, these differences are not hugely significant. So there was no difference really between outer London and inner London in terms of interest in accessing support. As you might expect, businesses that were struggling were more likely to say that they would benefit from external support. Definitely support needs across the range of business sizes, so even providers with 3 sites or more were still interested in accessing support, in addition to those with a single site. And a whole range of demand across both maintained, not-for-profit and private sector provision as well. So whilst at the onset of the project there was an expectation that perhaps it may be smaller nurseries, sessional operators, and that, you know, in deprived areas that would be most in need of support or highest in demand, that hasn't really borne out in the figures to a huge extent, because in actual fact there is demand across the board. Thanks, Michael. In terms of childminders, there was slightly lower levels of interest, although still high at over 1 in 2 interested in accessing support of some form or another. This flattened out a little with age and experience. So childminders that have been operating for 5 years or more were less likely to feel the need for external support than those that have been operating for up to 5 years. And similarly, on the age side, over 40 years of age, demand dropped to 48%, whereas in childminders up to 40 years of age, it was almost 3/4. There was also slightly higher demand from childminders from Black, Asian and minority ethnic groups as well. Thank you, Michael. So I mentioned that we looked at support needs in quite some detail. This table just actually shows the top categories within which there was multiple different subjects of support that people could express an interest in. But just looking down the left of the table there, these were the broad categories used. There was the area of the immediate response to COVID. So this was things like accessing tests, the furlough support scheme, all of the kind of guidance that's been published around managing COVID risk within provision. So that kind of immediate COVID response within settings. There was broad demand for that level of support still, although less so in the case of non-domestic providers than for childminders. When you're looking at the figures here, the first column shows the percentage of the whole of London providers that were interested in that type of support, and the figure following that is the number, how that equates to the number of providers when you extrapolate that across London. So beyond that category, the most common was developing and marketing your services. So there's a whole raft of things in here, like how is demand changing? How might you need to change your provision to take that into account? How you promote your provision and getting help around different marketing channels, a whole range of things within that broad category. And that was pretty popular at around 1 in 3 non-domestic providers interested in supporting that area, and just almost 1/4 of childminders. And you can see the remaining categories there. Developing and managing people speaks for itself. Managing finance, so understanding delivery costs, forecasting costs, setting fees, getting paid, managing bad debt, all those kinds of areas. Organisation leadership, and although that was termed slightly differently for childminders. It was that essential element of deciding direction and making things happen in order to achieve it. Using technology, looked at issues around how, getting support and using technology to streamline things and make operations more efficient, and also to open up communication with parents as well. And sustainable environmental communities had one of the lower levels of demand, and this was all around managing your impact on the environment. So there is broad interest across a range of subjects, was basically the key message here, but particular interest in developing a marketing provision, and I think that was really directly related to the fact that occupancy levels are falling, and therefore people need to be more active around adapting what they're doing to respond to the changing market. Thanks, Michael. We also dug into how people would like that support delivered, and again, this was done on a really detailed basis, and this is just an overview of that picture, and this particular slide is for non-domestic provision, so nurseries, preschools. The thing that stands out here is that actually, as you might expect, there is not a one-size-fits-all scenario here. There is a real need for layered support through multiple channels. Interestingly, demand was quite high for training course provision, as opposed to seminar, workshop, and more bite-sized kind of support that we've seen quite a lot of over the pandemic period. But that is, the seminars, workshops, bite-sized things are also in evidence there as well in the green. Coaching and consultancy, so much more depth and much more detailed support was again in evidence as being required, particularly around organisation leadership, which again makes sense in terms of the focus of that particular support, and for using technology as well. And clearly people still also value peer support through networking and support from colleagues. Thank you, Michael. Looking at the picture for childminders, again, really heavy emphasis on training course provision, less emphasis on coaching and consultancy, markedly lower than for non-domestic providers. And peer support, I think, a little bit more marked for childminders than it was for nurseries and preschools. Thanks, Michael. So what have people been accessing in the past? What does that tell us about things going forward? Around slightly less actually than 1 in 2 providers had access support in the past 3 years, so 43% for childminders and 45% for nurseries and preschools. And the bulk of that came in the form of peer-to-peer support, so quite a heavy emphasis there. Workshops and seminars and formal courses were in evidence but accessed by fewer people, and coaching and consultancy were lower again, and particularly for childminders, very low on coaching and consultancy input. Looking at who's delivering that provision, there is a strong emphasis on public sector supply, particularly marked in the case of childminders. 81% of childminders who'd access support said it came through the public sector. This is particularly concerning because on the supply side of things, most of the evidence is pointing to a retraction of local authority support as authorities are coming under increasing funding pressures. So that paints a worrying picture going forward. Private sector provision is evident and has been accessed by providers in the past, and also the voluntary sector side of things to a small extent has been involved in delivery as well. Thanks, Michael. This slide is a really positive one in the sense that experience where people have accessed support in the past has generally been very positive. So the blue and orange are excellent and good ratings, and they stretch across most of the chart, capped off with some average ratings and a sprinkling of mixed reviews on the non-domestic side, and just a little smattering of poor and very poor reviews for childminders. So overall, the message on that one is pretty clear. People have been happy with what they've had in the past. So that's a good platform for going forward.
Oh, sorry.
That's fine, Michael. I was ready.
Oh,
You're telepathic.
okay. Sorry.
Of course, there are barriers out there to accessing the support needed, and the predominant one is cost. This was particularly marked in the case of nurseries and preschools and maintained provision. So 42% said cost was a barrier to them accessing the support they needed. Less so for childminders, but I think this is connected with the finding that childminders was less likely to have accessed coaching and consultancy in the past, more expensive types of support. The other significant barriers were just not knowing where to start looking, not knowing where to start a search for the kind of support that you need, and equally knowing what it is that you need. That kind of whole thing around not knowing what you don't know, that's definitely a factor which is holding people back from accessing support. Other factors are in there. There are some doubts about quality, and there are some poor experiences in the past which have shaped future inclinations to seek support, but actually these are mostly in the minority in comparison to some of the other issues. Thanks, Michael.
Oh, is that me done? Thank you, Joe. I was expecting another slide on there. Thank you, everybody. Hopefully what you've seen from Joe's headline findings from the research is that it was a wide-ranging raft of questions we asked of people, from both in terms of their consideration of how their experiences have been in the past and what they might look to in the future. And it's allowed us to draw from that a series of summaries, which I'll just run through on the slide we've got there, because I think I'd be interested in your sense of whether this is a position that you would recognise from your own circumstances, or if you feel as though there's something that you would have made comment on or considered differently if asked. Generally, we would like to think that providers are happy with the business support they have received, and that there is generally an appetite for more, which I think is a positive start. As Joe indicated from the information, the vast majority of provision has come from local authorities across London. And as we recognise, their financial circumstances were difficult even before we went into the pandemic, after 10 years of austerity. And so there is a consideration of how sustainable that level of support is going to be as we go through the post-pandemic period. There was a general question from the focus groups we did and from the survey, and I'll be interested in people's comments on this in the questions box, that the language of business support doesn't necessarily resonate with all early years providers. Some, to the extent that in focus groups people were suggesting that they were not perceived or did not perceive themselves as businesses. Their circumstances meant that they had been set up for particular, whether it was faith-based circumstances or particular charitable aims. So the language of running as a business for some, was challenging, whilst on the other hand, there were those who had developed huge amounts of business acumen and recognised absolutely that one more child can make a difference to their sustainability, or that if expenditure exceeds income, the future is not looking bright. So I'd welcome comments on that, because it is still an emerging picture and everybody has their own perception on it. And that, I think, also led to a consideration, as Joe indicated, of people not necessarily knowing what it is they need to know. If business support providers just talk in terms of those generics of we can offer business support, sometimes that's confusing to practitioners in the sector. Whereas if you were to focus language on this will help your business become sustainable, this is how we will help you market to ensure you get sufficient demand from parents. Being explicit with providers can help identify and focus their minds on what their particular needs are at any one time. So also there is a consideration that not even when we've got the language correct, supporting practitioners to identify what their particular needs are is part of the challenge that is faced, because then we can actually hone down on what's the how best are those needs met. I remember in one of the focus groups, a lady who had come up through the traditional route into management because she was interested in early years because she wanted to help preschool children. She has now found herself in the manager position and realized that she needed to be an expert in spreadsheets, in human resources management, in legal application of tenancies, forecasting, planning, marketing, media, absolutely everything, social worker, etc. So identifying what are the key elements of business support that are going to help individuals at any given time is really quite an analytical challenge. There was also consideration of this idea of I don't know where to look for support. So the consideration is, should there be a single point of access that is then promoted and becomes understood by London's providers, where I need to go to this location to start my journey to access business support? Clearly, as the survey responses and the information from the focus groups articulated, different models of support are essential. And you can imagine, obviously, that there are different cost implications for providers. Obviously, it's more cost intensive to do a one-to-one session with individuals, but at least that becomes absolutely bespoke to their needs. Whilst on the other hand, offering webinars such as this are quite cost effective to deliver, but have to essentially remain generic rather than identifying individuals' circumstances and responding to them. So once we need to identify and link up the supply with the demand, keep the delivery models varied, and obviously the time of day becomes a factor, people not being able to get out of ratios to attend training, and so freeing up time is always an issue. And then there is also the consideration of cost. And I would also, again, this is a particular question that I would invite you to comment on. It became apparent during the focus groups that many people have become very expert in their own skill set in supporting, meeting the business needs of their particular sector, their childminding business, and any other type of provision they have. And it set us wondering within the research team of, isn't that an untapped resource that we could encourage or incentivize to actually spread that expertise, knowledge more broadly to providers across London, in the local area, etc. Now, we are conscious that clearly there are circumstances of competition and possibly reluctance to engage in those sorts of suggestions, but we are all going to be in this together. The strength of London's early childhood education and care sector depends on there being wide-ranging accessibility for parents in all areas, and therefore there is a certain collective circumstance that we should give consideration to here. So I offer that as one of the emerging thoughts we have from the findings. So all of that is leading us to the recommendations that we are charged with providing back to the Greater London Authority and other sector providers. And I'm just reading at chat box questions now. Before I get into that, sorry, I'm trying to look at two screens on the same thing. And Julia has said, this whole situation has undoubtedly highlighted my own expertise. I thank you for that reflection, Julia. I think that will be shared by many people, that we're all looking at life through a far sharper prism in light of the pandemic, and recognizing that actually the analytical skills that we sometimes apply to how we're observing children's behavior and supporting their learning and development, we also need to put to our spreadsheets and our budgeting facilities to make sure we're sustainable. So the areas for recommendations, and these are still areas of evolving consideration. They are not structured into any sentences, etc. We are looking towards a consideration of a single, well-publicised point of entry for sector business support in London. We should be able to use our social media channels, our website, as should any of the other organisations, the Mayor's Office themselves, to promote a single point of access to say, if you want to start identifying and securing support for to maintain your sustainability, this is where you look. And I think that at least will bring some clarity, some coherence to one of the challenges that has been identified by providers in terms of not knowing where to look. We are also considering the notion around diagnostic support and tools, which will help you as practitioners identify what could help your immediate support needs, and also then point you in the direction of which organisations, which boroughs, which individuals could possibly help you in that search. We are also recognising that actually this is a London-wide situation here. So we would like to suggest that across all the stakeholders, there is the sum of the whole could be greater than that of the parts, that actually processes of collaboration, whether that's the Mayor's Office, the Greater London Assembly, the London councils, and the individual boroughs themselves, should actually try and pool resources, probably as too formal a phrase for it, but certainly collaborate beyond borough boundaries to identify and meet particular needs across the capital as a whole. Because as Joe's data indicated, these needs were across all areas, both inner and outer London, and also individual settings, chain settings, etc. So the themes and the requests seem to be quite common, and therefore we would hope that there is more to be gained by looking at a pan-London level than maybe looking just within individual community circumstances. Ideally, we would be looking at in-depth coaching, support, consultancy to drive real change. From the focus groups, these were the interventions that had most impact on their particular circumstances, and it's understandable. You have somebody sitting with you for a period of time, looking absolutely at your direct circumstances. That is, one would assume, going to be more helpful than something which is more generic and looks across the sector as a whole. However, there are cost implications for that, and we recognise that it may be something which is prohibitive from that point of view, but certainly it is seen as something within the range of delivery models that has had the most impact. We are also looking longer term. There is something in terms of, I realise I've just missed one out. The initial focus we'd identified was in terms of the immediate challenges of 2021-22. As Joe indicated, the current circumstances we face with the financial support from the Treasury, the furlough schemes, etc., are due to come to a close in 31st of March 21, and therefore we should, it is essential to think about that immediate period after that as some sort of normality is returned to provision. And so what we are looking to try and do is focus any available support on supporting those issues of financial planning, budgeting for the 21-22 year to try and get as much sustainability into the sector pan-London as is possible. But also there is a longer term support strategy as well, because there is the issue of succession planning within early years settings, childminders themselves, in terms of how is provision sustained beyond one individual. And I think there is what the evidence is suggesting is that this is an area where investment is important, because there are immediate hurdles to overcome, but we need to think to the future 5, 10, 15 years hence. And finally, all of this needs to be underpinned by the fact that we are only in existence as long as there is demand for formal childcare and early education in London. All the evidence seemed to be suggesting that there is reduction in demand, and I'd be interested in people's comments about whether they feel as though that's merely temporary in response to the immediate impacts of the pandemic, or whether there are some more structural changes going on. People working more from home, potentially, fewer people in work, unfortunately, as we understand that redundancy rates, unemployment rates are going to rise over the medium term, and how you feel as though that's going to impact on your provision locally and how you're forecasting that for the future. So one of the areas we will be looking to try and make recommendations in is in terms of how there are combinations of messaging to employers, to parents, just demonstrating the vital importance of early childhood education and care in the capital to sustain the economic and the social recovery and ensure we do not have a lost generation of young children who don't benefit now or in the future from high quality early years provision. Phew. Joe, just while I read some of the questions and comments that have come in, is there anything you would like to add to that? And then I shall feed these in.
I think it was a very comprehensive summary there, Michael. And yeah, it's been really interesting to pull these thoughts and ideas together. And there's been, I think, a lot of positive feedback around the ideas that have been floated so far.
Oh, great. Sorry, I had to just put myself on mute there for family reasons. Thank you. That's helpful. Just if I can just read a couple of the comments. Julie backed up her comment around the way her skills have improved by sort of thanking her whole team as well. It has been a bonding activity as much as anything else in terms of people pulling together. And also, she has to say, although she didn't say where she is, the local authority have been amazing all the way through. They've been accessible 24/7. I cannot fault them. She also indicates that being part of an NDNA leaders scheme has helped her coachees and staff throughout those times. Again, that's something which we reference within the report. It's a Mayor of London funded activity. Kaushika, I hope I've pronounced that correctly. Previously, there used to be a person employed by each borough who would help each provider in terms of their business need. Can we not explore this? Joe, whilst I go on, would you like to reference that back to the more general position about the circumstances across London boroughs?
Sure. I think generally speaking, the message that we were hearing quite loud and clear from the supply side of things is that there are still some really good pockets of support in particular boroughs, but that for many, that local authority support has just essentially been peeled back. As things stand, and with the funding situation being as it is, it's difficult to see how that level of support could perhaps be levelled up across the board in each and every borough, but potentially the line of thinking at present in terms of what's coming through from the research is that whilst it may not be feasible to have the same level of expertise replicated in every borough, it may well be feasible to pull together pools of expertise which could then be accessed cross borough boundaries. That's kind of the thinking that seems to be emerging, rather than the more resource intensive project of trying to bring back that level of staffing and expertise within each and every patch. But that it's, you know, totally appreciate that level of support has certainly been missed, and that comes through quite strongly.
Thank you. Just a comment from Sharon, which echoes a couple of others that have come in terms of she's making reference to the fact that there's no leadership and management training for early years practitioners, and I share that absolutely, Sharon. It's always fascinating that people come into this because of their particular vocational interest in working with children and find themselves in this in this situation where they're expected to have a huge skill set across the piece, and there is, and how that is supported. There's very little, it's not considered as something that the DFE necessarily would look to, because they're obviously interested in children's outcomes, and squaring that circle in terms of, well, you've got to have effective, viable provision to make sure that there are outcomes, or there is provision for children to attend is there. And I think what that also links back to, and thank you for the reminder, oh, they're coming in full and fast now. I will just add, one of the things we are looking towards is whether a learning program could be developed from the resources, materials, and sessions that are already there somehow, that these should be, there should be recognition, certified recognition of a managerial program. Now, we wouldn't be talking in terms of national qualification framework here, but certainly something which gives due recognition to the sheer commitment and training that people undergo in the areas of business management, as well as their early years expertise. That is something that we're trying to get to develop recommendations around. Debbie has asked a question: how many local authorities have paid funding last year's rate? Sadly, Richmond, oh, it's moving, have only paid for actuals. Joe, your expertise and knowledge around local authority funding, do we, is there something we can say specifically to that? I'm rather reluctant to spend, it's a recognised situation of the funding rates not being helpful, but if there's, is there anything specific you'd like to say in terms of funding rates being paid? Joe?
I don't have the information in front of me, but I am aware that the Alliance, I think, put out a freedom of information request and published that on their news section on the website.
We are collecting that, and yeah, that is
yeah.
available. And I'm not sure if Richmond's circumstance was there, but it is. We did receive them from, I think it was in the region of 2/3. And obviously, one of the big issues will be what is the circumstances to be paid in the spring term, in terms of whether it was paid on last February's figures, and that is yet to be determined as far as I'm aware. But if you don't mind, Debbie, I'd rather if we moved on, because it is acknowledged as a recognition that this sector was not in the most robust financial state as we came into the pandemic, as Joe's information on the slide suggested. So it obviously has been sent into even sharper relief now. Kaushika has suggested, if this is high on the Lord Mayor's, London Mayor's, sorry, not the Lord Mayor, the London Mayor's agenda, then there could be some match funding. We will look to explore that as best we can on your behalf, Kaushika. And then leadership management training, in my opinion, is all to do with experience and seeking new ways to get over scenarios. Thank you, Julia. That's an interesting point. And training on the job is essential. Thank you. Robin has, and I'm reading, it's quite a long one, but Joe, it looks like it's about a data thing. I was quite surprised to see non-domestic providers saying recruitment was an issue. Is this still the same? And are providers accessing Kickstart, apprentices, etc.? Is it because providers don't know about these schemes? We didn't ask anything specifically around that, Joe. Is there anything you'd like to make before I make a comment back to Robin?
So there wasn't any depth information collected about current recruitment challenges. It was picked up as one of the challenges across a range of challenges that providers reported. Certainly we're still hearing anecdotally that providers are struggling still around recruitment. And although, you know, you have this tension between the fact that actually, because demand is declining, then settings are potentially overstaffed and letting, you know, in a position where they have to let staff go. But there is also that the counter pressures of being able to staff settings to ratios when you have staff on sick and on you know, long-term absence leave or shielding or a whole range of different things, and managing that going forward. So there is that kind of additional need for flexibility and staffing perhaps to increase in some respects. So it is a real mixed picture, and I think you know, the intelligence, if you like, the intelligence gathering is probably behind the curve of what is actually happening at present. I know that there are some studies out there that are looking in more detail on this as we speak. So I think, that will be an emerging picture. I don't have any specific information about the Kickstart scheme and awareness of that.
I have a bit in terms of background, but sorry, I talked across you.
No, please do, no.
Well, I'll start with apprentices if you don't mind, Robin. Certainly, we are, the Alliance is an employer. We operate 65 preschools across the country. And we are also a training provider, so we look at apprenticeships from both sides. And I have to say, they are becoming increasingly in demand. We are receiving lots of applications for any apprentice vacancies we have, and also I would suggest that we are getting a very good quality of applicant as well. Now, I don't say that with any great glee, really, because I think it indicates that employment circumstances in other sectors may be looking downwards, and we are benefiting from that. So it's a certain slight sour taste, but I think you can see that it might, if you've not considered apprentices before as providers, then I would suggest that it's something you look into now. And again, there is more information available on our website on this. In terms of Kickstart, we again are looking to offer Kickstart programs to young people, and I think one of the issues here, it is, I think I'm correct in saying there is a minimum requirement of about 30 individuals before you become registered to offer places to 30 individuals as an eligibility criteria to access the scheme. Correct me, anybody please correct me if I'm wrong with that, but I think that might be problematic for small providers. But again, it does allow you to get access to very committed people, getting an early indication of their circumstances around a potential career in early years, and you can then lead them onto apprenticeship or into full-time employees. Oh, Robin is correcting me that I need to go through a gateway. Does that mean that smaller employers can access a gateway where they wouldn't be able to do 30 their time? I'm conscious I'm having a sort of a bilateral conversation with Robin here. Yes, absolutely. That's very kind. So there are routes in for smaller providers. Thank you. That's really helpful. That's not something I'd pursued because obviously as a larger employer, we went through a different route. So again, there is more information on the gov.uk website on this, and it is getting greater levels of traction and media attention. So it might be something that providers start to look at as a possible potential opportunity to overcome recruitment circumstances. Phew. Any other comments? That seems to have addressed the immediate ones that people were typing. Joe, whilst I'm just looking to see if there is anything else we need to cover, is there anything from you, just by giving people an opportunity to type in?
I can't think of anything that we haven't generally covered.
Okay. In which case, it just remains for me to give you a few more seconds if you have a last minute question you want to add into the chat box, just to see just the next stage of the project. Pat has asked the question, who monitors the COVID-19 business grant? I'm going to kick that to Joe because it's news to me. Joe?
Is this the business grant through local authorities if you are a business rated for business rate, if you're registered for business rates?
That's a direct question back to Pat.
Yeah.
Yes, please. So I think you're on the right lines, Joe.
So I think in that case, my guess would be it's the local authorities that are monitoring that at local level. I don't know if there's any upward reporting at a central level and how that's been monitored, I'm afraid, Pat, unfortunately. My guess would be that it's certainly funding that's overseen at local level.
Right. Okay. Thank you, Pat. The next stages for us, we have to provide the full written report by the 30th of November, which, unless I'm wrong, I think is next Monday. So I think your comments have been helpful and have reinforced our thinking in terms of the areas of recommendation that we need to be working through. And I think it's reassuring from our point of view, and hopefully, Joe, you agree, that every time we've road tested the findings we've had through the surveys and everything else, people have generally, I think, in this two-dimensional reality we're operating in, nodded their heads and added to rather than contradicted. Is that a safe summary?
Yes, I think there's been a lot of common thinking actually around the various different channels and forums that we've been able to engage with through the project, which is always very encouraging.
Excellent, thank you. And it just remains for me to say thank you for your engagement this evening. I'm conscious you're giving up an hour of your Tuesday evening. Robin has very kindly said a great piece of research. Hopefully GLA are listening and can come up with support solutions. I can't think of anything nicer to end on, Robin. So unless there's anything else from you, Joe, I will just say thank you to everybody and good night.
Thank you, everyone.
Thank you, everybody. Thank you. Good night.